Bicep tendonitis is inflammation of the bicep tendon. The bicep muscle runs across two joints, the shoulder joint and the elbow joint. So it's vital that we condition all of these muscles in the recovery phase to enhance full recovery. With bicep tendonitis, what we can often see or feel, is thickening of the shoulder joint. They can be painful upon palpation of the shoulder joint. They may have tenderness in palpation of the bicep muscle. They may be reluctant to extend their shoulder. They may be reluctant to flex their elbow, because these are all things that the bicep muscle is responsible for. They also maybe have a stiff gait, pulling up lame after exercise, or transferring their weight to the opposing leg. So what we need to do when we're doing body conditioning, of course we need to focus on all the muscles of the shoulder, but we also need to work on the muscles of the neck and the opposing leg. The muscles of the opposing leg will have extra strain put on them from compensatory gait patterns, and this leaves them prone to injury. So we need to condition these muscles to prevent this from occurring. So what we do in a body session, firstly, I'd like to heat the area with the palms of my hands, direct pressure on the points of the shoulder. I always do the opposing leg, just because I'm feeling for comparisons in the area. What also occurs with this injury is what we call muscle atrophy of the shoulder. So a decrease in muscle size, muscle mass, and therefore we need to address this with some strengthening exercises, which I'd prescribe when you come in for a physical therapy consultation. So we'd apply direct pressure to the point of the shoulder for approximately 5 minutes. Then we'd start with what we call circulation massage. So we want to increase circulation to our muscles, remove waste products, and promote healing. It also helps reduce tension in the muscles. Therefore, I'm allowed to address them with some therapeutic techniques. So with this condition, I'd always expect there to be some restrictions in the bicep muscles themselves and the shoulder muscles. So I'd do a superficial palpation assessment on all of the muscles, feeling for any tightness, taut bands that we need to address. Once we've done our circulation massage, I then will have identified areas of tightness or tautness, or if there's knots in the muscles, and work these with a kneading massage. So essentially I'm picking up and grasping the muscle and working on any limitations within the muscle. If there's an area with a taut band, I may address it with what we call friction massage or circulation massage to work out that knot and to loosen up the area. And then we go and assess the muscles again with our kneading massage. I use what we call muscle squeezing on our pectoral muscles. And I do the kneading technique on our triceps and also our scapular muscles as well. So I use the cranial border of the scapula as a guide to work along the muscles, and also the caudal border, which there can also be restrictions in these areas as well from holding up the leg and tension in the area. So once we've worked on all of the areas, worked out tight bands, torsions in the area, we then go back and hopefully feel an improvement in the muscles, feeling a lot more comfortable. We'd work the neck as well. That's with a kneading technique. And unless we were to identify a taut band in the area, we'd use some friction massage in that area. So massage is something that you can be doing at home. I'd advise you first to come in for a session, and then we can localize areas that need attention and give you some exercises that you can be doing at home. So with some strengthening exercises, we'd start very basically. So we have them standing, lifting opposing leg. So transferring weight to the affected leg, 1 second holds and down, and we repeat this 10 times, or to whatever's comfortable for the patient to begin with. And we always increase reps all the time that we hold them up, but we always start gently. And then we gently rock them from side to side, engaging the muscles. So we don't want to get the muscles inhibited from lack of use. So we want to keep them activated, but we need to slowly progress the strengthening exercises, not load them too early in the recovery phase. So at the clinic, I use what we call a wobble cushion. It's one of the strengthening exercises that we use. So we have them on the cushion, and we do those same exercises, so rocking from side to side, and then lifting the opposing leg. So with the uneven surface of the wobble cushion, it's making the muscles having to work harder. So as with any recovery, a really important thing is weight management. We don't want the animals to be holding any extra weight because it's going to add extra pressure on the joints and make the recovery harder. So obviously they're going to be rested for at least 8 weeks. In this time, they're not going to be as active. So we want to make sure that we manage their weight well, and then they're not increasing in size and making it more difficult for their mobility.